Very soon, in the year 2020, Malaysia will accomplish her vision as a high-income country. At the same time, we are also heading towards an aging nation. More than 7% of the Malaysia population will be categorized as senior citizen. Are we well prepared for it? Infections remain as a common cause of patients' presentation to hospital. However, the public thinks that every infection or fever necessitates an antibiotic treatment. A study on upper respiratory tract infections in Selangor, Malaysia, showed that 90% of the patients in survey are expecting antibiotics from their general practitioners. Are all fever caused by bacteria? And do they require any antibiotic treatment? What causes this misconception in public? Do we really know what is an antibiotic and what is it used for?
Antibiotik adalah ubatan yang digunakan untuk membunuh kuman yang boleh menyebabkan penyakit. Demam adalah tindak balas semula jadi badan. Ia akan bertindak balas bukan hanya kepada jangkitan kuman. Ia juga boleh berlaku sekiranya terdapat jangkitan virus ataupun kulat. Sekiranya antibiotik diberi kepada jangkitan kulat ataupun virus, ia sebenarnya tidak berkesan.
Some surveys in Malaysia and many other countries indicate that many patients believe antibiotics will cure viral infections such as cold, cough, and sore throat. This misconception leads them to request physicians to prescribe antibiotics regardless of the type of infection.
Kebanyakan demam yang berkaitan dengan batuk, sakit tekak, sesama disebabkan sebenarnya bukan oleh kuman tetapi oleh virus seperti adenovirus dan sebagainya. Sekiranya antibiotik diberi kepada jangkitan virus, ia tidak berkesan. Sebenarnya, jangkitan virus boleh baik dengan sendirinya tanpa antibiotik.
Antibiotics abuse and overuse will cause antibiotic resistance. According to the World Health Organization's Antimicrobial Resistance 2014 report, mortality because of antimicrobial resistance will be the highest in Asia at approximately over 4 million cases by 2050. We need to be aware of the superbug emergence.
Superbug adalah kuman yang sangat kebal. Ianya mempunyai kerintangan antibiotik yang sangat tinggi. Kuman-kuman ini tidak boleh diubati dengan antibiotik yang lazimnya diguna.
This bacterial resistance has become a global concern because it is threatening our ability to treat common infectious diseases, resulting in prolonged illness, disability, and even death.
Pada zaman sekarang, kita mempunyai masalah mendapati antibiotik yang baru. Antibiotik yang sedia ada tidak berkesan untuk merawati penyakit jangkitan superbug. Sebab itu, amat penting untuk kita mengelakkan kerintangan antibiotik itu sekarang sebelum kita kehabisan antibiotik yang boleh mengubati superbug.
The pace of antimicrobial development has slowed markedly in the past 20 years. As more resistance is acquired, we are eventually left without any effective drug therapies or alternative.
Superbug sudah mula bertapak di Malaysia. Contohnya CRE ataupun MRSA ataupun VRE. Kuman-kuman ini hanya sensitif kepada beberapa antibiotik sahaja. Sekiranya tidak dikawal, pada satu hari kita tidak akan lagi mempunyai antibiotik yang boleh merawat jangkitan kuman superbugs.
Different antibiotics treat different bacterial infections. A doctor may establish a thorough clinical assessment to ascertain the underlying disease process, and if it's an infection, doctor will predict the associated pathogens and select an antibiotic that will target the likely organisms. As a prescriber, doctors are the frontliner in navigating rational antibiotic use.
Seorang doktor yang bertanggungjawab tidak akan memberi antibiotik sekiranya setelah memeriksa pesakit tersebut didapati hanya mempunyai jangkitan virus. Rawatan simptomatik adalah mencukupi. Untuk pesakit pula diminta untuk memahami bahawa antibiotik bukanlah penyelesaiannya dan menerima rawatan doktor tersebut. Ini akan mengelakkan kerintangan antibiotik di masa hadapan. After a prescription is written by the attending doctor, the prescription will reach the pharmacy counter. So, what is going on behind the counter? In fact, pharmacists will firstly screen the prescription to ensure that there is no medication error, and then followed by medication refilling, labeling, and counter checking before it reaches a patient's hand. In contrast to the common public perception about pharmacists, their role and responsibility is not just limited to medication dispensing. Definitely, pharmacists is always concerned about medication administration and patient counseling.
After receiving antibiotic, you should follow the instruction correctly. Okay? Even if you feel better, you should not stop the antibiotic. If you stop the antibiotic halfway, those bacteria in your body may not completely kill. You revise and become stronger and resistant to the antibiotics. That's why we need to finish the whole course of antibiotic to make sure the bacteria be killed.
The importance of completing the whole course of antibiotics is being emphasized by pharmacists time and again, as this will prevent antibiotic resistance and the emergence of superbug. Pharmacists is no doubt another frontliner in promoting rational antibiotic use.
During dispensing medication, we should tell the patient what is the name of the medication, the indication of the medication, and what's the dose of the medication, and how to take it. Especially antibiotic. The duration of antibiotic is very important. To finish the whole course of the antibiotic is even more important to make sure the bacteria in our body is completely killed.
By doing medication counseling, pharmacists hope that patients will be 100% compliant to their medications, including antibiotics. Hospital and health clinic are not the only place to get medication. Retail pharmacies provides general healthcare advice and supplies prescription and non-prescription medication to the public. Hence, public may wonder, is it possible to directly approach retail pharmacy to purchase antibiotic? Let's listen to the Chief Pharmacist of the Johor State Pharmaceutical Services Division.
Yes, but with one condition, you need to see a doctor for a body checkup. And if antibiotic is really needed and indicated for you, the doctor will write a prescription whereby you can use that prescription to purchase the antibiotic at any retail pharmacy. For your information, antibiotics are not available at the counter purchases.
Some patients worry about the adverse reaction of medication, especially harmful effects to their renal and liver function. Healthcare providers are always there to provide education to patients. Having knowledge will definitely help to improve medication compliance. As a patient, you should understand your rights.
As a patient, you have the rights to know all medications prescribed to you, including antibiotics. Do inform your physician of any allergies that you have. From a prescription, you can get a lot of information, such as the name of the medication, how much of the medication that you need to take at each time, how often you need to take in a day, and how long you need to take the medication, including information with regards to your illness or current condition. If you have any inquiries about your medication, please feel free to ask your pharmacist. We are ready to assist you. We want to empower the public on proper use of medications, including the antibiotics. As a consumer, you play a very important role in taking care of your own health. We need your full cooperation to win the battle against the superbugs, so please work together with us.
Every healthcare provider plays their own role in combating antibiotic resistance. And as a patient, you have the responsibility as well. Do talk to your healthcare provider to determine if an antibiotic is the best treatment for your illness. So, avoid demanding antibiotics. Trust your healthcare providers. And finish the whole course of antibiotics as prescribed by your doctor. Let's do this together.